Okay, so my topic is actually allergy reaction, like allergy. So allergy is quite a big topic, I feel, or is it not? I'm not sure. You have to tell me.
How often do you?
It's a huge topic.
Oh.
Allergy is a huge topic. Yes.
Yes, there is obviously like the food allergy and then the skin allergy. I don't know if there's any other allergy because I only know there's these two. Yes, let's start with like skin allergies. So skin allergies, one of my friend did ask me this question before. Like, so if your dog is white, are they prone to, skin allergies?
So
For
just
example,
just for
like
the listeners, we're getting smiles all around.
yeah, my dog, not my dog, my friend asked me that. Yeah.
Okay. What happens here is when you're looking at the breed per se, color does not really matter that much.
Okay.
Whether it is white, whether it is black, whether it's brown. If you're looking at a skin allergy, it's just a skin allergy, that's what they say. But what is the predisposing cause to a skin allergy is many. A predisposing cause to a skin allergy can be even your dust mites which are on your bed. It does not need to be a white dog. Even a black dog can get it.
Okay.
So to say that a white dog is more prone to a skin allergy, then I would go to breed predisposition.
Yeah.
So if you go to breed predisposition, yes, West Highland Terriers are very prone to skin infections.
Okay.
You look at pugs, they are prone to skin infections. Those days we used to have sapes. Sapes were very prone to skin infections. So that then becomes a breed predisposition.
Yeah.
So a sape can be white.
I've never
Okay.
seen one.
Sharpei is the wrinkle.
Yeah, but why
a white
white
Sharpei?
Sharpei?
You have.
It's
They
like-
are beige. They are more beige
Okay.
colored. They are brown, beige. So breed predisposition is a completely different ballgame by itself.
Okay.
But if you're looking at allergies, allergies can be many. It can be food allergy, it can be mite allergy or ectoparasitic allergy, and it can be at times what is referred to now, or it has been in the market for a long time, which is referred to as atopic dermatitis. An allergy reaction with no specific cause. You can do all the tests that you want. You can do a pinch biopsy, you can do this, you can do that. It will still come back, everything is basically negative. There are also some tests that are run by certain countries, by certain groups which are referred to as allergy tests. Even then, with those type of allergy tests that they come out with, they can tell you, your dog is allergic to, say, like for example, mites.
Okay.
Your dog is allergic to bananas. Your dog is allergic to this. So then they come back and they tell you, look, use this diet, or you have to create a diet. So to me, allergy to the skin is because the skin is not nutritionally stable.
Yeah.
So what you do is build that skin up, put in the nutrients to support that skin.
Okay.
Leave the predisposing cause out of the equation. Leave the breed predisposition out of the equation. Build the strength of the skin, or build the health of the skin. So then what you do is you use all these other products which are available, multivitamins, vitamin A, vitamin D. A lot of us, we take a lot of vitamins because we are scared something will happen to us.
I have a whole stack over here.
But sometimes when you ask clients, do you give them multivitamins? No, the dog has already got Hill Science diet, or he's got don't quote me.
Oh,
No, it's okay.
He's already got, these breeds, these foods which are said to be, look, they are all complete meals.
Yeah.
But it does not mean that that particular meal is actually sufficient, or the nutrients in that meal is sufficient for the dog's growth. Yes, but there's nothing wrong in supplementing. So what I normally like to tell my clients is, like for example, very natural stuff. I like carrots, broccolis, cauliflowers, coconut oil, olive oil. So these are all omega-3, omega-6 fatty acids. They got vitamin A, D, E. build the strength of the skin so as for it to be able to sustain even though if it has an allergy reaction. Then we determine where the allergen is, and then from there we treat. And the other thing a lot of us like to use is we like to use a lot of medicated shampoos. You know, when you go to, if your dog has got an allergy reaction, the first thing they throw to you is either Malasab, Maladerm, all these things which have got, it's a shotgun therapy. I've got antifungal, antibacterial, anti-itch, I've got everything inside. But what we fail to realize is every single chemical, if it's not washed off properly, remains on the animal's body. You and I don't have hair. You wash properly. A dog has got a lot of hair. A cat has got a lot of hair. Now, if you don't rinse that animal off properly, that animal is going to have a certain layer of that chemical on the body. The shampoo does not tell you to leave it on the body. It says apply for at least about 5 to 10 minutes, rinse off. How many of us actually rinse off properly? We do not know. We cannot blame anyone for it. So when you have that kind of chemical sitting on the body, and if it's done every second week, it's done twice a week, that itself will cause dandruff.
So I'm going to jump in and share a story where doctor, and I don't know if you guys remember this, but you certainly made me raise my eyebrows. I brought in Yogi once with Yogi had a bunch of rashes on his belly, and I was like, what could it be? And then doctor said to me, go back, get a bottle of Johnson & Johnson's baby shampoo,
the baby one,
the baby one,
milk bath,
and shower your dog with that. And I was like, what is he talking about? And I did it, and the rash went away. The dog smells good. It's a lot cheaper than the other shampoo. It's a win.
So Johnson & Johnson, we're looking for sponsors. No, but so coming to that, because I think it's also quite a very, very nice topic to touch on, because we talk about prevention and stuff like that as well. So would you recommend raw diet per se, or would you also, like, how would you typically feed your dog? Like, because for me, in my sense of, because we train, we do a lot of vigorous activities and stuff like that. So before I actually go on for my training program, I start pumping my dog with like raw food, and then we go into hardcore training, and then after that, when we slow down, I go back to kibbles. So what is the perfect raw diet that you could actually recommend? Like, in the sense of, because from what we see online, 3% body weight of whatever raw, and then what kind of meat, etc., etc., etc. In your point of view, this is no professional statement, but it's just purely just a sort of recommendation.
I've got no experience with raw diets.
Okay.
I know that there's a lot of raw diets which they call buff diets or buff diets, which are around. Clients use it. A lot of our clients prefer to use it. But in honest contact, I do not have any idea as far as the raw diets or the science behind it. The main thing what you're saying is very true, because when you're working the dog, you need that protein, you need that fat. But once that training program is over, you can sort of drop the protein, drop the fat.
Correct.
That does not require you to drop the nutrients. That means, like, for example, your multivitamins and so on and so forth. With regards to raw diet, a lot of people are beginning to use raw diet. Mainly it's chicken, lamb, beef, and I think there's also a mixture of fish and some of them duck. Correct. I've got no problems with raw diet. I've got no squalms with the people supplying the raw diet. The only question I would ask my clients is, you're buying the raw diet, do you see the meat?
Right.
You don't see the meat first. Second thing, if you and I were to go into a supermarket and buy a packet of sausages, you've got a shrimp chopped down there. Who certifies this food?
Yes.
And a lot of our clients are so used to it, so confident. They say, no, doc, I just open the thing and feed it to him and he enjoys it. Yes, I don't deny the fact. But what is the content of it? I said, if you can buy the raw diet, why don't you make it yourself?
Correct.
What is so difficult?
Mm.
You're not going to boil anything. You're going to buy the chicken, you know from where
Yeah.
the source of the chicken is.
Mm.
You know, you take everything, you dice it, you put it together and give it to him. Story the end. You want to add a bit of coconut oil, 1 teaspoon or 1 tablespoon with some turmeric, with some pepper.
Yeah.
It's much better because you know the sauce.
So I guess the caution to listeners and to dog owners would be to think carefully about the source and content, where it's coming from and
Yes.
who's certifying it, if at all it's being certified.
No one certifies it.
Yeah.
Even the Department of Veterinary Services has got nothing to do with it. Because even when they were asked regarding as far as pet food is concerned many years ago, Sirim's first statement was, makanan haiwan we will never test. So when you don't have anyone that certifies that food, and if you can do it yourself, it's simply raw, why not do it yourself?
So just on the same vein, I think the question that Leanne had and something you spoke about earlier, there would also be concern. I mean, if dog owners or dog owners listening run out to the shop and start putting together their diet for their dogs, right? But surely at some point it pays to go and visit a vet to talk about the composition, the macros of it. Someone could be overdoing on their coconut oil, and someone could be overdoing on the kidney. So should dog owners speak with their vets about the change in the diet and the content of the diet?
They can do that. It's also based on the breed, what the breed requires, which directly goes back to the vet for him to be aware of what the breed's requirements are. Sometimes some of us do not. I myself am not an expert on what are the protein requirements or what are the requirements of the breed. But yes, there are a lot of websites that you can read. You can find out. You can always consult. It is very much more a sort of a win-win situation if you were to discuss it so as to get some points from here, or the vet can also get some points from you. Going back to the raw diet, I might, in case this goes on air.
And it will.
But you agree to this, yeah?
But what I would also suggest because sometimes owners don't have the time, right?
Yeah.
You can take that raw diet, give it a steam, a simple steam. You want to boil it, you can boil it. If you want to steam it like how you do dim sum, you want to steam it, just steam it. At least there's a certain amount of heat that kills whatever there is inside there. And then give it to them. Cool it and give it to them. There's no problem as far as that is concerned. But as far as nutrition part of it, I think there's a lot in the case of nutrition based on the breed, like what Brandon says with regards to working dogs. So all those things will come into play. What are the protein requirements? What are the fat requirements? Say, like, for example, if a dog is already neutered, does he require this amount of fat? Does he require this amount of protein?
Okay, since we're on that, I jump into that first.
I'm telling you, there are a lot of questions.
Yes, there's a lot of questions.
So coming to the neutering part of it. Personally, I don't really mind if my dog is neutered or spayed or whatnot. But in terms of, your professional statements, I think, because it's more important coming from you. For me, is I don't really care. But does it matter if a dog is neutered or spayed throughout its lifetime? Like, do they have to get spayed? Like, so I've had a dog for about 11, 12 years, and she's still a virgin, and she's not spayed. So what's your take on this point?
Neutering by itself is recommended very much more on the grounds of two factors. One factor is, just like us humans, females go on cycle. So when the cycle takes place, there's a lot of changes within the development of the uterus, the cervix, and so on and so forth. Now, if that particular dog is well managed, you don't need to neuter the dog.
Well managed in terms
In the
of
sense that the
health.
cleanliness of
Right.
the dog is kept clean because of the bleeding. You know, you clean the dog up. You don't have the menstrual cycle all over. The dog is not licking. Now, if that is properly managed, the environment is well maintained. There is no sense for contamination to take place or infection to take place. And just similar to us, as we grow old, our immune system becomes compromised.
Yeah.
Now, why do you see pyometra happening in most elderly dogs? It's simply because when the immune system gets compromised, the dog is still cycling, or the cat is still cycling. Upward trend of infection goes in. Because as long as the cervix remains open during that menstrual cycle, any infection can go in. And that is where it tends to build up. So, that is one. The second thing, the purpose of neutering is to minimize that particular risk when an animal needs to be neutered at an elderly age. Third thing is, at times, neutering helps to cut down to a certain extent aggression. Aggression to a certain extent is also cut down because the hormonal imbalance comes into play. This is very common, especially in the males. Now, why do we castrate the males? Again, going back to the similarity in the case of humans, use and disuse theory comes into play. You don't use that dog for mating. As age catches on, his prostate is going to get enlarged. You have prostate enlargement. When you have prostate enlargement, you tend to have blood in the urine. And one of the lines of treatment for prostate enlargement is castration. So if you're not going to breed that dog, you might as well do that to at least prevent you from having the animal castrated at a much much older age.
And there's more danger associated with doing
Exactly.
the exercise at a later date.
The danger part of it is there, but the bigger thing is the cosmetic part of it.
Okay.
When they are young and you do the castration, the scrotal sac regresses. When they are old and you do the castration, it still hangs there.
So what is the perfect age? What's the perfect age for spaying and neutering? Like, what would you recommend?
I would say you can start at approximately, give and take, depending again on the breed. Depending on the breed, you can start around 8 months.
Okay.
8 months you can do till approximately 2.5 to 3 years. No problem. So some of them will like to have one cycle and then go in and neuter the pet. Some of them say, look, let's get it done as early as possible so that we don't, especially in cases of sometimes male dogs where they tend to mark their territory.
Yeah.
So some clients do not like that. And then also in the case of cats, especially male cats who start to mark their territory. So because of that, complete your vaccination. That is very important. Until and unless it's a stray cat and it's in dire straits, look, it's a matter of whether that cat is neutered or it gets pregnant. Or whether that dog is a stray dog, whether it's going to get pregnant. So what do I do first? No vaccinations. So what do I do first? Check the animal. Animal is healthy. Everything is fine with the animal. Go ahead, neuter the animal. Do the vaccination later.
Okay. Yeah, I have another question. So it's a very controversial question. So it's chicken. Yeah, a lot of people say that, my dog is allergic to chicken. Is that true? What's the reason that's causing it?
Currently speaking, I would say yes, it might be. There might be an element of truth in it. I would not be able to actually tell you precisely, but let's look at the way, as far as the quality of control with regards to farms are concerned, poultry farms.
True.
So when you look at control to poultry farms, that is completely depleted. There is not much of control in poultry farms. So what goes in, we do not know.
Yeah.
All right. To be very precise, has to pick farms. Pig farms are very well controlled simply because we export to Singapore.
Mm.
Poultry, we don't.
Mm.
So in that particular context, yes, if there's a lot of what do you call this food that is given to the birds, in the context that they are not properly nutritionally managed, then what can happen is you can have allergy reactions within the animal itself, which can then be transferred on to, like for example, an allergy reaction to your dog or an allergy reaction to your cat. But then again, the question that comes back is, how does this happen if you were to actually cook it? It does not happen. Because let's assume that I'm putting steroids into the dog, into the bird, into the chicken. Okay.
I like chicken.
Putting steroids into the chicken or putting any other additives or anything of that sort, not very sure what they do. But if it is processed with regards to heat treatment and so on and so forth, it completely is clear of. But when it is fed raw, the tendency is always very much higher. You cannot elude that. Even, for example, even when you're looking at our own vegetables, for that matter, you know, when it is raw, it's a completely different ballgame because we do not know what goes into it until and unless we are looking at ayam kampung.
Yeah.
But ayam kampung, who sees the kampung?
Which kampung?
Right.
Alright.
Also, is it like, let's say if I'm feeding this dog chicken for her entire diet, and it's like, will there be a possible chance where, you know, just like just suddenly one day she just started to have some allergic reaction? Will that still be chicken, or will that be another factor, or you know, that kind of thing? Will that actually happen? Like if I keep feeding my dog chicken, she has been eating chicken the whole time, then suddenly she just reacted. Will there be a chance of
Yeah,
her?
there is a possibility. No, I would not say there is a chance of the chicken being the problem.
Yeah.
I will not also say there is not a chance of the chicken not being the problem. But what you have to do is identify where is the allergen. You cannot blame the chicken.
Poor chicken.
Exactly. You have been feeding the guy chicken all this while.
Yeah.
Okay. And suddenly he develops an allergy. So the question here is identify what the allergen is. Sometimes some of us, what we tend to do is, my dog is scratching.
Yeah.
Okay. He's got rashes all over his body. Sometimes if you're able to look at it and say, look, it's surface rash, or say like for example it's a mosquito rash or something of that sort. For example, in Dalmatians, because they are white-haired dogs, sometimes if they're left outside, you get in the morning more like sort of papules which build up on their body, which is a reaction to mosquito bites and stuff like that. It can happen.
Okay.
So in that particular respect, we have to identify where is the primary cause. In certain cases, if it's a simple allergy reaction, yes, the use of antihistamines will clear the whole problem off. If it's a food allergy, you take out the chicken after 48 hours. Once the chicken is out of the system, maximum 72 hours, the allergen must reduce, the skin must come back to normal. If that does not happen, chicken is not the cause.
Oh, okay.
Okay. Then the other thing that you do is the possibilities of whether the allergen is either an allergen which is more towards the surface in contact. Where is it located? Is it on the ventral aspect of the animal? Is it in contact with the surface? Is it all over his body? So these are certain things that you would need to identify, which would then indirectly say, look, let's do some work.
Yeah.
It's either blood work that you can do to identify if there's inflammation, or the other thing, most simple thing, is just take a pluck of hair or use a swab, take a swab sample and send it to the lab and identify. But to directly say that chicken is the cause of it, or the protein source, let's look at it from the protein source, immaterial whether it's chicken, whether the protein source is the primary cause, take it off. Within 72 hours it should clear.
Nice. Isolated.
Yeah, so that would be like a recommendation for home, like let's say dog owners. instead of going to the vet straight away?
No.
No?
Look for doctor. Actually, that comes. So, Dr. Clement is offering discounts.
Sorry.
Actually, that's a very nice segue. So just before we wrap it up, because we know we could have you here all day. Can you share with us a bit about the services you guys offer? What can I come to you for? When all that sort of stuff. So maybe just share a bit about your services, your operating hours, that sort of thing. Emergencies. Very.
Maybe this is a question for Anne.
Yeah, might be a few answers.
So for the listeners listening, we were trying to get Anne and Doctor to come in. I think it was on Wednesday, but Doctor was on standby. I'm sure you guys are on standby for multiple things all the time. So I think it'd be interesting for our listeners to know when we can turn to you, where can we find you, what kind of services you guys offer. The doctor's like, don't come and look for me. keep your allergies away from me.
The one main thing that we have to look at is, or at least make it very clear, it is not advertising.
No.
As far as the services that we provide,
Yeah.
as I said, my main line of interest is dentistry and scopes. So that is my main line of interest. I also do soft tissue surgeries. Soft tissue surgeries we do. The other things is your normal vaccination, your deworming, and any other form of problems that you have. With regards to skin, I think, as James has said, yes, I have an interest in skin, and we do look at a fair amount of skin problems and so on and so forth. With regards to the services or the equipments that we have a full range of biochemistry equipments, blood chemistry equipments, which can do all the tests, except for certain tests that we send outside. With regards to the clinic per se, our working hours are very much clear. You can go to our website or Facebook, you can see our working hours. The entire place is basically, the entire place is managed by Anne. Now we have our daughter inside, so she's also helping out.
Well done.
So as to allow us to move out.
Yeah.
How did you manage to convince her?
So in that particular respect, that is what we do. Now, with regards to animals or pets, to be more precise, which are in-house, and if they are on fluid line therapy, we have to stay back. We can't leave them and go, because animals will not sit quietly like humans.
They will weather through the
They will move around and those lines get entangled. So you have to be around to make sure that the lines are intact and everything is fine. So in that particular respect, we stay on. Most of the time, with regards to emergency services, if there are clients who we know, to be more precise, who text us or call us, we will answer.
That's the emergency
Yes,
number.
no.
So you wanna say no?
We will answer. I will definitely answer, or if it is, as long as we are in the clinic, we will normally answer the calls if they come to my mobile. And as far as WhatsApp messages are concerned, I do have clients who WhatsApp me and say, look, Clement, this is what is happening. Do I need to bring him tomorrow? Is it an emergency? Yes, we do that.
That's wonderful. And so you mentioned your website and Facebook. What's the website address?
The IVET clinic.
No, not website. Facebook.
The
Facebook.
Facebook is just Taman Tun Dr. Ismail Veterinary Clinic, Sindrian Berhad.
Okay. So it's spelled out the full TTDI?
Oh, yes.
So Taman Tun Dr. Ismail Veterinary Clinic, Sindrian Berhad.